This is an ideal smile.
Well, ideal can vary so much from person to person, situation to situation. That's why here at LA Dental, when you come in for a consultation, we really want to take into consideration your goals, your specific situation, what you want to get out of this whole process, and to fit all that in within your particular facial anatomy. Hi, I'm Dr. Areezo.
I'm Dr. Azy.
I focus on implants, sedations, and surgeries.
I focus on veneers, bonding, Invisalign, and biomimetics.
We are the owners of LA Dental Clinic in Los Angeles, California.
One of the things I look at is your incisal display. We take a bunch of photos. One of the photos we take is with you saying Emma, like that, because this is basically your lips at rest, slightly open. What I'm looking at is how much of your upper front teeth you're showing when you do that. As we age, one of the things that happens is that our teeth wear away from grinding, from chipping, things like that, and we end up showing less of our upper front teeth. The other thing that happens is as we age, our soft tissue starts to droop down. That's why people get facelifts, right? But that also covers your upper lip. By the way, if you are getting lip fillers, that's another negative with regards to your incisal display because it can really cover up your teeth. What I ideally want is for younger people to show about 50% or half of the lower edges of their upper two front teeth and a little bit of the other ones.
Yes.
And as you get a little bit older, maybe about 30%, this will make you look more youthful.
Another thing that I look at, and I know you look at, is canine guidance, or the function of the teeth. Now, the canines are these four teeth, the eye teeth that we have in the corners of our mouth. Their job is to be the pillars of the mouth. So when you're moving your jaw around, they're supposed to slide past each other and lift off the other teeth. So when you're grinding side to side, your back teeth really shouldn't touch and your front teeth really shouldn't touch. But a lot of people have lost their canine guidance just because of the canines are in the wrong position or they got worn down. And once that happens, the whole thing collapses. Then that's when you start to see chipping or broken molars. Things just start to collapse because now the forces are being spread in the wrong places. So we're really looking at the function. Yes, we want to show beautiful teeth, but if we just put beautiful teeth in there and they're hitting each other in the wrong way, they're gonna break.
Another really important thing that I look at is your golden ratio. So basically, this is a ratio that we find in nature that is reproduced. And it's about kind of the length to the width of your teeth. If you look at an individual tooth, there's a particular ratio that looks natural to us. So if your teeth are really wide and squat, for example, sometimes patients will come in and they'll have a big gap and they'll want me to close that gap with composite bonding or a porcelain veneer. But if their teeth are already a decent size and width, and we're trying to add more to close that, that's going to look unnatural.
It looks really bad.
Yeah, and that's because we are going against the golden ratio in nature. It just doesn't look right to the eye, right? So we look at golden ratio with regards to length to width, and also with regards to the width of your front teeth relative to the width of your next two teeth, which are your laterals, relative to the width of your next two teeth, which are your canines from the sides.
Yes.
So we look at all of these things to figure out. We want to get you a smile that fits the frame of your lips when you're smiling, that you show a little bit of tooth when you're just at rest. So we look at functionality as a technical standpoint, and we look at how the smile fits you, and then we try to incorporate that and get you a beautiful smile that fits your vision.
Right, and we always like to do these interim steps to show you what it's gonna look like. So whether I'm doing a full mouth rehabilitation where we're placing implants and replacing all the teeth, or if we're doing a few bondings, we always have a little step in between to show you how things are gonna look. You can even go out with it and try it on, and you'll be able to see and kind of function with this new teeth sizes or new teeth positions. And that's really important to us to make sure that it works. It's not just about how it looks, it has to actually function in your daily life.
Sure, that's our trial smile.
That's our trial smile.
Anytime we do cosmetic work or anything that's changing the function of your teeth, we will try that in.
Yes. So if you're looking to get a smile makeover, or if you want to get a consultation, come see us here at LA Dental. We always want to make everything personalized and specific to you. We want to take your situation into consideration and create a smile that is not only beautiful, but that can function for you and last for you. So come see us, LA Dental Clinic here in Los Angeles, California.